One of them had used the medicines that I gave her, but didn't have any relief and said, I think I have a sleep disorder. My husband says I snore like a train. And she was young, healthy, didn't have a fat neck. She was in her middle 30s. There was no reason why she should have sleep apnea. We were not being told to look for sleep apnea in that population. And frankly, I didn't think sleep really was applicable to my patient group. So I sent her for a sleep study. She turns out to have sleep apnea. She puts on this torture device and she comes back 3 or 4 weeks later saying, my headaches are gone. And I was just blown away by that because I have this very biochemical view of how the brain works and what migraine is like. And I've been doing headache for a long, long time, and my medicines are supposed to work. Yet I also know they don't exactly. They wear off, they're temporary. And so she puts on this torture device that, in my view, can't have a placebo effect, okay? You cannot strap on one of those things while you're sleeping and go, oh, this is wonderful. Nobody wants to do that. Her headaches went away. So that started a journey where I thought, I got hundreds of other patients with daily headaches. I'm just going to start doing sleep studies on them. And if they have sleep apnea, I can treat them. Well, they didn't have sleep apnea. Most of them did not. So this population is young, healthy females. Most of the people with daily headache are young, healthy females. They've had a couple of kids. That's about it. I start doing sleep studies on little kids with headaches, teenagers, and some males. And as I start to do more and more sleep studies, I realize, and it takes a while, they don't have sleep apnea, but they don't have normal sleep. And that takes a couple of years before the pulmonologists, so that it's the lung doctors, because they were on the machines, that had gotten into this sleep apnea. That means when you don't have the right phases of sleep, but you don't stop breathing, they just don't put it on the report. Okay. My pulmonologist says to me, hey, I don't know if you've noticed this, but your patients don't have as much rapid eye movement sleep as they should have. And sometimes they just stop breathing in rapid eye movement sleep. And I'm like, well, that's not on the report. And he says, yeah, I know. And I'm like, wait. I've sent you hundreds of people. Their sleep studies are abnormal. And you've sent me a report that says no significant apnea. That means I have to really completely change the way I'm thinking about it. So it started with apnea. But now that I've done hundreds of sleep studies, and these young, healthy people have a very specific finding. One, most of the time, their complaint is, I wake up at 3 a.m. and I can't go back to sleep, if they have a sleep complaint. The second complaint is, I sleep, but I'm tired. So they aren't snoring. They don't have the typical things that would alert them to having a sleep disorder. They just don't feel as good as they used to. A lot of them are heavily trained, long distance runners, CrossFit. They're doing all the things that everybody's told them to do with their diet and their exercise, but they still feel tired, or they can't remember, in a bad mood. First thing and most important, this is not affecting just my population. These are sleep studies around the world now. And for 5 years, I've been deeply into this, and I realized, no, this is impacting everyone. I happen to be looking at a young, healthy population, but every single person I see in the stroke, when I see work on the weekends, every single one of these people has sleep disorders, and sleep apnea is just a tip of the iceberg. And I've got all these little kids who have abnormal sleep. This is terrible. What's going to happen to them? The second question would be why? Because I know this was not the case in the 1960s, 70s. When I was in medical school, I was in the San Francisco Bay Area. The original sleep studies where we first started were in the 60s and 70s. They were at Stanford. They were really done on Stanford medical students and Stanford college students. This epidemic did not exist then. Okay, so I've lived before and after, and also seen all these other diseases become epidemic. Why is ADHD being seen in huge numbers at the same time that there's a sleep problem that's 80% of the population? The things that started showing up in the 80s, fibromyalgia, chronic fatigue, ADHD, those are diagnoses that we haven't really clarified completely, and they all started to show up after we graduated from medical school. So B12 turns out to have a big history of helping with sleep. There's a whole literature about it. So I just start to do B12 levels in all these people who have daily headache. And it turns out that the B12 is low in the really, really sick ones, but not all of them. in about the third week of doing that, somebody mentions to me, hey, my doctor did my vitamin D level, it was low, she gave me vitamin D and my wrist pain went away. Remember how I was thinking like these movements, these CPAP devices, they don't help with these extra movements. They just blow air up in the nose.
Yeah.
So we still don't have a good answer for how these increased movements affect us. So I think, that's what I'm thinking about when she says, vitamin D made her wrist pain go away. And, I know nothing about vitamins. I've been trained away from them. So I happen to say, look, I'm drawing blood anyway. Let's throw the vitamin D level in there. So it's completely by accident. I'm absolutely naive. I have nothing to offer these people. Sleeping pills work for a while and then they don't get better. But getting to sleep better helps their headaches, helps their memory, helps their mood. So now I'm like a sleep maniac. I'll talk to anybody about sleep. But the problem is that we don't have an intervention. We have sleeping pills, which we're all unsatisfied with, and we have the CPAP device, but we don't have an answer for why these people would be having a problem, especially somebody who sleeps 10 solid hours, but the chemistry clearly in the background is so screwed up. Yeah. So for 4 months, again, by accident, between August and December of 2009, I'm doing a B12 and a D level on every single person that I've got in my practice who's had a sleep study. They have all sorts of diagnoses, but probably at least 50 to 60% of them have daily headache, and all of their Ds are low. And I'm like, well, this is weird. And it's at the end of the summer. Like this is the highest it's going to be all year for them, except that I'm writing these lab slips every night saying, you don't have a B12 deficiency, but you have D, take this D stuff. And then in December, 2 guys come back in the same week and say, you said this CPAP would help my headache and it didn't, but you sent me that note the last time I was in here and you told me to take that vitamin D and I did. And in about 3 weeks, my sleep got better and then my headaches went away. 2 guys tell me that in a week. No articles written at that time. There was an article written in January by a guy in Shreveport, just down the road from me. But the next search terms were vitamin D in the brain. And I stumble into a guy who's been writing about vitamin D, where the vitamin D receptors are. So if the vitamin D does something, it has to have a D receptor. And he has written about these nuclei, the nucleus pontus reticularis oralis caudalis, this long stripe of cells in the brainstem that no one knows about, okay? I'm a neurologist, I don't know about it. This guy has actually shown that there are vitamin D receptors in the sleep switches that make us paralyzed. He's shown that there are vitamin D receptors in the switches that run the clock. So the clock is about what time do we fall asleep? How do we coordinate these changes in the ratios of the neurotransmitters over an 8-hour span, really over a 24-hour span. So when people say, gee, your circadian rhythm isn't okay, what they're talking about is really light comes through the eye and coordinates our brain linked into a 24-hour cycle. That is very well publicized, okay? And that actually is linked to a vitamin 2 because it goes light, eye, retinoids, vitamin A, pineal gland, and then those messages have to be coordinated to a switching system that says it's 10 o'clock, time for you to go to bed. And then it puts out these chemical mixes that say drowsy. It's a warning phase. So we perceive it as, oh, it's time for me to go to bed. But it really happens all of a sudden, like you're not sleepy and then you are, and then you're not asleep. You're just sleepy because all of a sudden, Amy, you're about to be paralyzed. You better be in your little nest before that happens. So it's thinking about sleep as being one, heavily coordinated to the clock. And it turns out vitamin D is heavily imbued in the clock. Why? The guy that I stumble on is a guy named Walter Stumpf. And he's already written 30 years, starting in the early 80s, that this is a second hormone. A is actually a vitamin, but it's also a hormone. We do get it in orally. D is a hormone that we make on our own skin when we're in the sun, and it coordinates us to the winter-summer cycle. That means if you've ever heard about the concept of hibernation, there has to be a way that we link what our body does in the winter to the fact that it's winter. How do we do that? Well, Walter clarifies the whole thing and says, well, it turns out this particular wavelength that makes this hormone on our skin goes away in the winter sunlight. UVA is still there, but UVB is not. So it's a hormone, and he has already put together an explanation for, oh, what are the things that you would like to link to the seasons? Fertility. If you don't have any food because it's 4 feet of snow and there's no way for you to get any food, you don't want to have your babies then. Oh, would you like to sleep longer and lower your metabolic rate so you can survive the lack of food? The dermatologists in the 80s are just starting to say, sunburn is bad for you.
Yeah.
Now they've become so radicalized that being in the sun is bad for you. That's insane. It turns out they are not able to focus on the fact that their protecting of their organ, the skin, has led to these horrible outcomes because we were meant to live out in the sun. Every animal lives out in the sun, okay? Being outdoors is not just about D. It is about multiple other wavelengths of energy that were there since the beginning, okay? This world is not about humans. It's about hundreds of millions of other animals, and they've all had these biologic processes, and we're the dummies who went indoors. There's a guy that's got a website called the Vitamin D Council who actually made it available for testing by lay people. So the important part in the background is you can get your own D tested anywhere in the United States, except for 3 states. It's $39. It's cheap. There are some really specific things you have to know about which test you want to get. But there was a website that the psychiatrist in California had established. That was my only teacher. And then I just started giving higher doses. And it was quite clear that as the vitamin D blood level crossed over 60, we all started sleeping better. And I was like, wow, this is weird. So this is a clinical observation. There was this consistent feeling once it got over 60, and between 60 and 80 is the right blood level for better sleep in someone who's had a sleep disorder. That has consistently stayed the same, okay? My problem is I don't have anybody except me who's been doing this for 12 years. If you're lucky, they actually recommend a blood level. If you're unlucky, they recommend a dose, which is incorrect. Every single person has a different level of deficiency. That means their need for that vitamin D depends on how incredibly depleted their cells are. Some of my patients had to go up to 30 or 40,000 a day. What we've been told is, oh, fat people need bigger doses. That's also completely incorrect. And also that, oh, they're not absorbing it. But if you follow that patient over years, what you will find is as they get better, in the 3rd or 4th year after they're actually going back to work and they're sleeping better and their pain is gone and their gallbladder disease went away and all these other things, now all of a sudden they're on too much. And then they drop down. That means that their body was actually sucking up the vitamin D into every cell and using it. That means that person who takes 30,000 to maintain a level of 60 is using 30,000 a day. Most normal humans, and this is only most, usually wind up at around 8 to 10,000 in the winter, half that in the summer. My American Academy of Family Practice will not give me any continuing medical education credits for anything that has vitamin D on it. All the other parts of the course, and their very first, so they are actually functionally suppressing education about this because it is not current accepted medical therapy. Well, it's not currently accepted. It's never going to be if you don't teach the doctors about it. So one, vitamin D is attached to everything about our body. What happens if I think I'm a really outside person, which is the way I look at it, okay? And I actually go outside and I don't take D and my level drops back to 35 again. And I'm like, damn, what does that mean, okay? Does that mean I'm not, well, it means that the amount of outside life we have is nothing like it was in the past. We don't really get up and walk outside. I'm not sitting out on my patio now. I'm doing that in the summer, but I'm not sitting right in the sun as I'm talking to you like I would have been when I was raising my sheep, in the past. All of my patients start coming back and saying, I used to be much better. Now my butt hurts, my legs hurt, my foot hurts, I just been told I have lupus. All these things start coming back. The D level is still perfect. And I don't feel like, ooh, I'm doing something that's really out there. And it turns out that what's happened, I'm going to give it to you as the final answer. What happened was our microbiome requires D. So luckily for me, microbiome became a big, big deal by that time, early 2010 through 2018. And we're starting to trade, recipes for probiotics. And it turns out that this D deficiency also affects the microbiome. That means the epidemic of D deficiency is not just about D. It's about anything that the microbiome used to do for us. We don't have that. And it turns out the microbiome, one, makes the 8 B vitamins. Those 8 B vitamins are actually first published in the 20s and 30s as bacterial growth factors. I mean, if you go back into the history of this, it becomes obvious that somebody figured out, oh, like vitamin A, and then there are 8 things called B. Like, what's up with that? Why would there be 8 things called B? That doesn't make any sense. It took me years to actually, wait, I never even thought of this, okay? Somebody back in the past realized that, one, they came from a bacterial culture. You actually cultured the bacteria, and then you made the observation that, you know, when I boil this liquid that has bacteria growing in it, then I can't get these little yellow guys with the black tips to grow in my Petri dish. Oh, I wonder if there are factors in there that are helping them grow. So the idea that there were essential elements from the surroundings, in the background, it meant you had a symbiotic foursome of phyla of bacteria. One of them makes thiamine, and this other guy needs thiamine, and the other one makes riboflavin. So they make these 8 chemicals, and that 8-pack of the chemicals are called the 8 B vitamins. Those bacteria that normally live inside us when we have a D level appropriate for living outdoors would have then provided all the raw materials we need, like every other animal out there that doesn't go to GNC and get supplements. The squirrels are not out here with little signs saying, give me my zinc, okay? Our biology actually came second to those bugs. Those bacteria have been here billions of years before we came. That means the first step is understanding that when you get D deficient, you are now B vitamin deficient, and several of the Bs, not just B12, but thiamine and another one called B5, who everybody has ignored, play a huge role in making the neurotransmitters that allow us to sleep. That means D was the answer for a while, but as you slept better and asked your body to make repairs, which is what we really want to happen, we don't want to just be unconscious and lie there like a lump. We want to do stuff to make us feel better. You use up your B stores. We are told that bees don't hurt people. That's a lie. We're told we don't have stores, that you can actually just give as much as you want and everybody be okay. That is completely wrong. Now, everybody who's popped out by a mom who has a D that's below 40, they don't start off their life with a normal microbiome. And therefore, many of the things about neurologic development, both in utero and in early childhood, are linked to these things that are being provided by mom's microbiome when they're in utero and by the baby's microbiome as they're growing. So when you lose the microbiome, 3 major things are lost. Our ability to absorb and not overabsorb most of the small charged ions, iron, copper, manganese, all of these cofactors that are needed for various enzymes. The bugs have always played a role in those minerals being absorbed normally. They don't just sit there, they actually secrete chemicals that we absorb and play a role in our ability to notice, do I have too much iron? So the first article that really shows that the microbiome is involved in making sure that we have the right response to low iron. So there's actually a messenger that's extremely complex that's telling the bugs whether or not I need to absorb iron, and it also talks about whether or not I'm in iron overload. That means that microbiome has always played a role in that. You have to view it through an evolutionary lens that says every single animal on this planet has these little enzymes that need 1 copper molecule or 1 zinc molecule. Somehow they've been managing it without us smart doctors helping them. It was natural and it just happened. So when you lost your D, the microbiome went away. And what I then learned was, in order to bring back the microbiome, which you must do, so the sleep is dependent on the microbiome directly as well. So you have to not only give D, but you have to give this stuff called B50, which is 50 milligrams or 50 micrograms of every one of the Bs. It turns out there's a way to convert the microbiome, but it's not about dumping lactobacillus, a specific species. It's about getting the right growth factors for them, their requirements, until the 4 healthy, happy phyla are able to come back. Once they come back, then you have to stop the additional Bs, because our nervous system was actually created around their natural production. We only need the amount that they make, and then the vitamins do really bad things to you. I've been fully trained, as have you, that we take these blood levels and then we do things with them. And for D, we're using that because we still need it. But for none of these B vitamins, except for B12, is the blood level in any way related to what the neurologic symptoms are. They are not. If you've ever gotten into this a little deeper, like magnesium blood levels have nothing to do with what your cell needs. And it has nothing to do with what your cells in the brain need, because even if you did the blood level, it wouldn't be about the CSF or the central nervous system area. So The other thing that's really creepy about this that makes it very difficult to sell to physicians and even to lay people is the only way you know if you're deficient in some of these things is by what your body tells you, which sounds totally flaky, but frankly, I had to learn that over time because I would be saying, hey, I'm the doctor, I've got the piece of paper, it's got the lab results, I must be right, okay? And you must be the stupid patient who doesn't know that your body just said, I don't feel good, I don't feel the same. And I actually had to learn that most of the time, if I was gonna have a debate about, I think your D is too high, I think your D is too low, the patient would usually be right. And they couldn't even tell me exactly what it was, but they just had this feeling, okay?
Yeah.
That is absolutely the same for the B vitamins as well. There is scientific literature that shows that the blood level has nothing to do with what the B stores are like in the body. And the need is overwhelming, okay? It is, everybody needs to know about this. Were my colleagues interested? No, they're still not interested. The vitamin word comes out of my mouth and they just like eye roll, she's gone over to the other side, okay? So frustrating for me because this is the basis of biochemistry. Like I'm showing you these biochemical pathways and telling you that when your D goes low, eventually your bugs go away and you become deficient in one of the most commonly used neurotransmitters that runs the parasympathetic side of the autonomic nervous system. So all of these things that we're learning about breath, about exercise, about meditation, dialing up the parasympathetic side, they're all valid. But if you run out of the juice, that stuff, if you have a deficiency state where you can't make acetylcholine, which is clinically how this presents. And interestingly, there are a whole bunch of articles now that if you just type in cholinergic deficiency disorders into PubMed, they're all over the place. ADHD, cholinergic deficiency at nicotinic receptors, Parkinson's disease, Alzheimer's disease, autism. There are scientific reports that show that we're acetylcholine deficient in the brain. So I stumble into the pathway that allows us to become acetylcholine deficient, not even knowing that these are well-reported syndromes. Doesn't address the 50,000 other things that all the scientists are writing about. If you don't have the right microbiome, then these are the things that happen to you. The things that are clinically most important are things that are linked to the B vitamins, which autoimmunity and allergy are directly related to acetylcholine in the background. So the 8 B vitamins, B5 in particular, is really the raw material needed to make acetylcholine. So you're missing the B vitamins, you're missing the endocannabinoids, which is why cannabis is what people are reaching for their pain. In some people, their major deficiency state is the cannabinoids. That's why it's completely unique. There isn't anything else that copies it. And then the third piece is, it is my clinical experience that suggests that many of the ions that the naturopath and the functional medicine people measure, so you're zinc deficient, or you're copper deficient, or you're iron deficient, those are all run by the microbiome. And they were being done without our consent and without our understanding. And it's not simple as we just absorb, it's they detoxify us. Why is it that I have mercury fillings and I don't have a high mercury level, whereas the next person does? And it's linked to this.